Well, good afternoon, everybody, and thank you so much for coming. We all want to welcome you to the second ever Policy on Tap discussion hosted by the Greater San Fernando Valley Chamber of Commerce. Over the next year, Policy on Tap will bring together government and industry leaders to discuss the pressing issues of the day. From today's topics, healthcare to entertainment, technology, transportation, and more. We want to hear about what's working and what isn't in the Valley and what can be done better now and how, and discuss some big ideas for the future of the Greater San Fernando Valley. Today, we have three amazing guest speakers with us who will be discussing the topic of healthcare and sharing their thoughts. The San Fernando Valley's own Congressman Tony Cardenas is with us, along with Facey Medical Group's Dr. Roscoe Marter and Dr. Richard Wong with Kaiser Permanente. They will be joined by our moderator and former Chamber Board Chair, Cindy Keitel. Now, before I turn it over to Cindy, I want to acknowledge our sponsors, California Lutheran University and SoCal Gas, whose support really had made this entire event possible and events like it in the future, hopefully. So thank you all very much for coming and taking the time. And I'll hand it over to our very own Cindy Keitel. Go ahead, Cindy.
Great. Thank you so much, Josh. Well, before we begin, I want to explain today's format. And if you were with us for our first Policy on Tap, you'll see it's a very similar format. Each speaker has been asked to give remarks on the topic for 10 minutes to talk about the state of healthcare in the San Fernando Valley, our response to the pandemic, and what changes to the healthcare system may be on the horizon. We'll be ringing a bell at 1 minute before the time limit, so speakers know their time to speak is coming to a close. Now, I want to call on Nancy just for a moment. Let's test that bell. Okay, can our speakers hear the bell? Last time we didn't all hear it.
The last time I had some weird setting on.
Yes, it was funny because we just went on and on when we didn't hear the bell. So anyway, following the presentations, we will have a prepared Q&A portion for speakers, with each speaker having 2 minutes to answer. And that's the reason for the bell as well. Time permitting, we're going to take questions from all of you out there in our audience via the chat window. And while our panelists are speaking, if I could ask you right now, please put yourselves on mute, because we'll get background noise and other disturbances otherwise. So if you could do that for us now, that would be great. But speakers, please keep your mics on. So I believe our first speaker will be arriving here shortly. I'm just going to do a quick check-in. Should we go to our second speaker?
Sure.
Okay, you want me to give me another 20 seconds?
Well, Michelle, Congressman might be a few minutes late, so we could just start. And
yeah, okay. he was trying to log in, but was having trouble with the link. He just texted me, so I resent it again. So hopefully he'll join us in the next minute or so.
Okay, great. Well, why don't we go on to our second speaker, and we'll go back to the Congressman as soon as he arrives. What will be our first speaker tonight is going to be Dr. Marter. He's the CEO of Facey Medical Group, a position he has held since 2019. Dr. Marter moved to Southern California for medical school at Loma Linda University, where he also does residency as an OBGYN. Dr. Marter has been with Facey Medical Group since 1999, serving as staff physician, department chair, regional medical director, and vice president. Facey is a physician-owned practice that's been serving the Valley for over 95 years. That's a long time. Dr. Marter will be discussing how healthcare responded to the pandemic and how healthcare will look different in the future as a result of it. So let's turn it over now to Dr. Marter.
Well, thank you all for having me, and I appreciate the opportunity to get in front of everybody with some of the things that are near and dear to our hearts. So, you know, a couple of things. Most of us know COVID happened, and it happened over the last year. It kind of started about this time last year. And when it happened, everybody kind of hunkered down. We had to transition a lot in terms of just acquiring PPE in order to be able to see patients safely and to be able to, you know, work with patients that we didn't know if they were sick or they weren't. And what kind of sick, and if they had COVID or if they just had all of the other things that they came with on a regular basis. And so a lot of things that we did at that time was to try and create, you know, special surge clinics or fever clinics to try and isolate the patients into that area and keep the other ones that just came in for the usual sprains and strains and diabetes and all the other things that people have and try and keep everybody comfortable in the event of having to come in to see the physician. We learned a lot in that time frame on things that we could do. We scrounged PPE from all sorts of different places, from local schools, from foreign countries, from wherever we could find it, but eventually we were able to pull that together. But I think what we did, which was important, was learning to screen patients, staff, physicians, and then clean and clean and clean and everything that we could find and wipe down and do it over again. Because as you know, people are not accustomed to wearing masks, and it takes a while to get used to wearing one properly, quite honestly, because we tend to, take it off quick to cough into our hand, and then you realize that wasn't the right thing to do, and because otherwise it's kind of wet inside your mask, and it's annoying, but it's necessary and it's important. And so what we ended up having to do is to really try and set up pathways for people to be taken care of safely. I was kind of looking at my telemedicine notes from right before the pandemic, and we were talking about how were we going to roll something like this out.
Or press 9 to be removed from our list.
And then what we found was 2 months later, all of a sudden, everybody was on board with telemedicine. So the payers were on board, the patients were on board, the physicians all of a sudden were excited to try this new modality that they weren't really wild about doing before, quite honestly. Because it's much easier to just pop from room to room and see your patients. But all of a sudden it was like, oh no, we'll see them on video. We'll figure out whatever we got to do. We'll call them. We'll do what we need to do. And the patients were like, no, I'm more than happy to try and, work out my Zoom address and get that set up. And so everybody became aligned in that, which was really fortunate. And it allowed us to really leap forward in terms of that capability. And so that's what I mean, and the other thing that we learned was all of the things that we had learned in medical school didn't apply to this pandemic. Other than washing your hands and covering your mouth, not a whole lot else mattered. So there was a lot of medicines that we used and a lot of trials that we tried, and most of them we found over time weren't all that effective. And then some of it was effective, but only for a certain period of time. And so our hospitals became better and better at treating it, setting up the right order sets, getting things arranged in such a way as to manage them. Our urgent cares got better at screening people. And then, it really got scary around December when we had to figure out if we were going to need to ration resources, who we were going to need to be able to take off vents and different things like this. Fortunately, it never got there, but we were getting ready. And it was a scary thing to actually have to get ready to take people off events because we needed them for somebody else. It was something that we had talked about for a long time, but never had to consider really in this country. So, fortunately that topped out. And so I think now what we're looking at is how do we make the transition, hopefully out of COVID. We reach down into our lower tiers and hopefully that trend will continue. But I think what we need to keep in mind as we move forward is what are the important things going forward? How do we get back to a normalcy of treating what we know is still baseline disease that's out there? How do we approach that? And I think it's a matter of managing this transition. So the transition will include vaccination, of course, learning how to, get everybody vaccinated as quickly as we can, starting, of course, with the most vulnerable, which we've been doing pretty well at. But now working our way down into those that are not as old, but still have medical issues, continuing to mask up for a period of time. Hopefully this will end at some point as well. I think I don't look as good in a mask. Others would debate that, but nonetheless, I think it's important for us to learn to still live with masks for a period of time, to maintain some physical distance. And how do we do that, in stores and grocery stores and clothing stores and other places that we need to interact. But I think people are learning to deal with that. And then cleaning as much as we can, wiping down surfaces and trying to maintain those physical distance, all the things that we've talked about. But once we do that sort of thing, and the numbers continue to come down, how do we now transition back to taking care of diabetes, taking care of obesity, taking care of the new onset alcoholism that we all kind of developed over the last year? CHF, all of the congestive heart failures and and obstructive pulmonary disease and all these other things that everybody had before the pandemic, but kind of got ignored and dealt with later and later and later. Dr. Wong and I make our living trying to preemptively manage these type of things before they become very, deep into the weeds, because that's better for the patients. It's better for us. It's better for healthcare. It's better for everybody if we can manage that on an earlier basis, preventing the type of diseases that or conditions, hopefully, that affect us all eventually, but putting them off as long as we can. And so we need to take the lessons that we learned from the pandemic of having telemedicine and being able to use that as another modality of reaching out to patients, reaching out to them in their homes, being able to see them in their place of residence. And it gives you a little different view of the world. It allows convenience for patients as well, to be able to, not have to get on a bus to come see us, not have to wrestle the 3 kids into the strollers and whatever it is it takes to come to the office to have a visit that's going to last 10 minutes or so. How do you find ways to make that make more sense? And I think telemedicine is one new weapon that we've developed, or one new modality that we've been able to really accelerate and be able to do that. But we're going to need to continue to have support for that. Hopefully CMS will continue to see its way clear to pay for these type of visits, so that it makes sense for everybody involved. So telemedicine is a learning that we really got from the pandemic, that we need to continue for everybody's benefit, for payers, for physicians, and most importantly for the patients, so that they have options, so that they have a way to reach out to us in a way that's quicker, easier, much more efficient as well. And that's really what I think we're going to need to manage over the next couple of months even, and hopefully only a couple of months, but really over the next 6 to 12 months as we transition out of it. How do we get back to coordinated care? So looking at basic things, colorectal cancer screening, breast cancer screening, all the things that nobody wanted to do because they didn't want to come in for any type of visits, managing diabetes care, cardiovascular care, immunizations, vaccinations are kind of top of everybody's mind right now, but how do we, do that with the, for pediatrics as well, so that that's, not an issue. So we can get beyond, all the other viruses and other things that kids used to get before the pandemic. So all of these are things that are going to be top of mind as we now make this transition out of what's been pressing and urgent now onto things that are much more of a priority, even though they aren't quite as pressing or quite as urgent. So being able to manage that is what we're kind of looking forward to, getting back to the normalcy of chronic care. So that's where I think we need to kind of look at where we've been, what have we learned, and how do we manage going forward into the next few months and years, and take the lessons that we've learned and continue them going forward. I don't know where I am in terms of my 10 minutes, but I think I've run out of things to talk about. So
I think you're done. Cindy.
Yes. Thank you so much, Dr. Marter. We'll be getting back to you to elaborate on those points a little further when we get into the additional questions. So thank you for not making us ring the bell. Generally, when we have congressmen and council members on, we're ringing the bell a lot. So I wonder what the relationship is there. So I don't think our congressman has made it yet.
He's here. He's here now.
He is here. Okay, fabulous. So without further ado, let me introduce what would have been our first speaker, and that is Congressman Tony Cardenas, who began his political career 25 years ago when he became a member of the California State Assembly, and later as a Los Angeles City Council member representing the Central and Northeast San Fernando Valley. For the past 8 years, Tony has served as a member of Congress for the Valley's 29th district. Congressman Cardenas sits on the Committee on Energy and Commerce Subcommittee on Health. Congressmember Cardenas will also look forward to hearing about we look forward to hearing about the prospects of healthcare reform from you in Washington. I know you've been very busy today dealing with lots of issues. We're really happy you can join us. So without further ado, you have 10 minutes to talk about that. Thank you.
Okay, thank you very much. I don't know if you can see me, I can hear you. Hopefully you can hear me. Thank you for inviting me. I just wanted to say thank you for being a part of the San Fernando Valley for over 100 years, going on 110, it's my understanding, for the Greater San Fernando Valley Chamber of Commerce. I used to be a business owner myself, but one of the reasons why I ran for office in 1996 to be a member of the State Assembly representing the San Fernando Valley is because I realized that too many Americans, too many taxpayers, too many voters don't understand what small businesses go through, where the buck stops there, and that you work really hard to make sure that you have a successful business, not so much for yourself, but for the people that work for you and the clients that you serve and the people that you serve and the pride that people take in running their sole proprietor business or their business where you actually know the people's names that work for you and you know the customers that you serve. So I just wanted to say thank you for representing all of those amazing businesses, both small and large, in the San Fernando Valley. I want to first point out that the American Rescue Plan was something that just got signed, and it was done in well within the first 70 days of President Biden's presidency. And I think it's really important for people to understand that we've lost a lot of faith in elected officials as they talk a lot, but don't follow through with their actions commensurate with their rhetoric and their speaking. And I personally spoke with the then Vice President Biden when he was a candidate, and we had a face-to-face meeting, and I was very difficult with him and very hard on him and asking him what he's going to do in his first 100 days, in his first 6 months, and his first term as president. And one of the things that he said he was going to do is we're going to crush the virus. And with this $1.9 trillion package, with all due respect to those people on the call, I would love to hear the dialogue and your feedback on whether or not you thought the alternative package that kept getting pushed forward was a $600 billion package. It's my understanding that we have people on this call who work directly in the healthcare space, and not only as healthcare providers, but also as individuals who are administrators, ladies and gentlemen. It's one thing to save lives and help stop the bleeding, literally, but it's another thing to run an organization where healthcare is so critical to the care and also to the well-being of us in America that we take things for granted, like our lifestyle. So I just wanted to mention that this package includes making sure that we get billions of dollars to our hospitals and caregivers to make sure that not only can we crush this virus, but we can replenish those organizations so that they don't go bankrupt while they're saving lives, while we're crushing this virus. In addition to that, unlike the $600 billion package that was talked about a lot, but nobody really talked about the fact that there was almost zero money going to local governments. Well, ladies and gentlemen, the local governments, cities, counties, special districts, water districts, the state legislatures, the state governments, they were robbing Peter to pay Paul to crush this pandemic. And had we not replenished and got them back into shape, you would have seen firefighters being laid off. You would have seen police officers being laid off. You would have seen every service that we are so just lucky to take for granted in America. We would have seen those services cut in some cases by 10%, 20%, 30%, or even more. And as business owners, I know that you understand that you can't look at your dealings monolithically. You have to realize that to serve is not just linear. It's very complicated. And local government does a lot of things. I'm not here to defend whether or not they do them great or not, but what I'm here to say is we're not going to be happy if we see our governments laying off police officers, firefighters, and county organizations laying off nurses and doctors, and the list goes on. In addition to that, everybody's been clamoring about our children going back to school, and there's $160 billion in that plan, far, far more aggressive than the other $600 billion plan that was talked about. There's $130 billion to make sure that we get our K-8 schools open as soon as possible. And again, it's not just about opening, it's about doing it safely. And with all due respect, I think a lot of business owners know the difference between just opening your doors and doing it in the way that's both complicated and respectful to yourself as a business and the people you serve. In addition to that, this is the the one plan that is affecting over 85% of households in a positive way, whether it's with the $1,400 per person stimulus payment, or it's the single mom, like single moms here in the San Fernando Valley who's lost their jobs. They're going to be able to get up to $4,000 over the next 12 months to make sure that they can feed their children, keep a roof over their head, and hopefully get back to work when our economy starts to rebound. And it's in addition to that, what people don't usually talk about is the millions and millions of people just right here in California alone who have lost their jobs. It's really important for us to understand that it's businesses that want to rehire those people, and it's businesses who want to go ahead and thrive again. But without the workers being able to get through this pandemic, we are not going to see them come back to the workplace. So it's a complicated environment, ladies and gentlemen. I'm very proud to say that with this new President Biden, we've been able to do more in the last, less than 90 days than we were able to do in a total of a year in the previous year, in which we were experiencing this horrible pandemic, which has taken 500,000+ lives and has decimated the workplace for too many families, to the tune of over 10 million people. At the peak, there was at least 14 million lives that were affected who were without work since this pandemic hit. And we're getting better, but the bottom line is we still have millions and millions of families to make whole by helping them do what they want to do. They don't want a handout. Yes, they can take a hand up right now, but at the same time, they want to get back to work. And again, I'm glad to talk to the chamber today, and hopefully we have some time for some questions. Thank you very much.
Great, thank you, Congressman Cardenas. I think we'd like to circle back to your question too a little later in the program, because you did want to hear from us about America's Rescue Plan, about the alternative, and get reactions from our chamber. So why don't we, with that, go on to our third panelist, and that's going to be Dr. Wong. And Dr. Richard Wong is a physician liaison for government relations at Kaiser Permanente. Dr. Wong served in private practice as a cardiologist prior to 2015, when he joined the Southern California Permanente Medical Group. Dr. Wong studied medicine at New York University prior to moving to Southern California to do his internship and residency in internal medicine at UCLA Medical Center. Dr. Wong, you have 10 minutes.
Thank you, Cindy, for the introduction. Congressman Cardenas, thank you for the update. The information you presented was very useful for me and for our organization. And Dr. Marter, you made some very good points about the challenges faced by physicians during the COVID crisis. So I have a tough act to follow, the two of you. So as Cindy mentioned, I started working at Kaiser Permanente in 2015. And since that time, have realized the benefits of an integrated healthcare delivery organization. During medical school and training, there was minimal discussion about healthcare delivery. Patients either had insurance or no insurance. When I started working in private practice, that's when I began to learn about the complexity of healthcare delivery and the challenges faced by patients and physicians. Kaiser Permanente's integrated healthcare model allows for efficient and effective patient care because of cooperation between the health plan, the hospital system, and the physician group. The concept of patient-centered care has always been a focus for the organization and continues to be our goal when dealing with the challenges brought on by the COVID-19 pandemic. Kaiser Permanente has already made significant investments to improve care delivery, such as a patient portal, telehealth, and home-based treatments. For example, our cardiology department provided a smartwatch to patients who underwent coronary artery bypass surgery, so they can participate in home-based cardiac rehab therapy instead of driving to an outside facility. This dramatically improved patient compliance with a completion rate of 80% versus 50% for traditional facility-based cardiac rehab programs. During the pandemic, COVID-19 patients were provided with a Wi-Fi enabled pulse oximeter, so their oxygen status can be monitored remotely. This allowed patients to safely recover at home without taking up a hospital room, which were in short supply. Going forward, Kaiser Permanente will continue to invest in technology that will allow for more home-based monitoring and treatment, which will improve care and lower costs. The infrastructure investments made prior to the onset of the pandemic allowed Kaiser Permanente to pivot quickly during the multiple surges. For example, our telehealth visits went from 15% pre-pandemic to 80% during the peak. While that percentage will decrease as the pandemic eases, we expect telehealth visits to represent a larger percentage of visits in the future. One of the major telehealth challenges going forward is ensuring our patients have adequate internet access, as that was a significant hurdle for many physicians providing telehealth. From personal experience, I had to convert many video visits to telephone visits because patients had poor internet access. When caring for a patient, the focus extends beyond just treating the acute medical problem, but also addressing the non-medical issues that contribute to a patient's overall health. Health education, nutrition counseling, and social worker assistance are easily accessible for patients. In many instances, improving a patient's social situation can dramatically improve their health and result in healthcare savings. The COVID-19 pandemic was very disruptive to the healthcare workforce. People who worked in outpatient clinics saw their hours reduced, while people who worked in hospitals couldn't get enough time off to get much needed rest. Kaiser Permanente's integrated healthcare model was able to overcome these challenges. By shifting staff from outpatient to inpatient settings, healthcare workers could maintain their usual hours while honoring requests for time off work. As we shift the focus from treating COVID-19 patients to vaccinating the community, Kaiser has the ability to redirect staff to the most needed areas. And finally, in addition to caring for patients, Kaiser also focuses on the wellness of their healthcare force. The pandemic created new challenges for many of my colleagues, and Kaiser Permanente provided multiple lines of support, such as additional time off, grants for childcare, and flexible work schedules. Counseling services were readily available for the staff, and the importance of wellness was emphasized on a regular basis. I truly appreciate Kaiser Permanente's attention on the mental and social well-being of their workforce, as a healthier workforce translates into better patient care. Thank you very much for your attention. And I'll give back my extra time.
Okay, thank you, Dr. Wong. I keep turning myself off and forgetting. We have to remember doing on and off. Thank you, Dr. Wong. And I know we're going to circle back to you on a few things with the questions, like that you've shifted to 80% telemedicine, the technology, the home-based treatments and monitoring you've been doing, the social situation, all those are important, and we'll be adding those into additional questions. So now that each of the three panelists has had an opportunity for their opening remarks, why don't we go on to some specific questions? And I do want to thank you. You're amazing panelists. We are so lucky to have you all with us today. So let's first do a round of applause, and we can do it virtual. I can actually applaud, but you can put up your thumbs or do the hand or whatever on the virtual platform that we're on. So thank you all for that. Now we're going to go on to another way to do questions. Each speaker is going to have 2 minutes to answer a question. We're going to ring a bell, which will be 10 seconds before your time limit. And that way you're going to know that you have to kind of wrap it up. So let's start out first with a question for the Congressman. So Congressman Cardenas, can you please briefly make a case for why businesses might support healthcare reforms, such as Medicaid for all, the single payer system? Have we lost him?
Hold on,
Sure.
can you hear me now?
Yeah.
Yes.
Yeah.
Okay, sorry about that. I don't normally do Zooms on my phone, but I couldn't log in with my iPad to my computer, so here we are. Sorry about that. So when it comes to a single payer system, that's being contemplated right now in Washington. Also, when it comes to health Medicare for all, which is another thing that's being contemplated among many. But when you look at a single payer system, we're looking at something in Washington where we could possibly have that, and in addition to that, have private healthcare insurers, et cetera, so that people would have more options. But one thing's for sure, we want to make sure that we bring down the cost of healthcare to the individual end user and to the individual patients and families across the country. In addition to that, what we'd like to do is make sure that we have a healthcare system where even if you can continue or able to continue with your own healthcare provider, a private insurance system, that we actually have controls and costs and ways in which people are not gouged and people can actually continue to have healthcare and still afford it. One of the things that I want to point out that we're determined not to let go is the pre-existing condition, which is the Affordable Care Act brought that about for the first time in the United States of America. And it's really fortunate that we can take these things for granted, so that most Americans forgot what it's like to have a pre-existing condition for them or their children, and then all of a sudden realize that their insurance will insure the entire family, except for their 10-year-old son who has asthma. Yes, of course, they would offer insurance for that son, but they would pay as much as $1,000, $2,000, $5,000 per month just to make sure that if the child's asthma put that child in the hospital, that the insurance would cover it. But now in America, whether you've had cancer or your child has asthma or whatever the pre-existing condition is, you will have health care access and you will not be denied. Another thing as well, we had those expensive policies that actually would say, okay, we'll pay up to the first $1 million. Let's just say if you have cancer and you've had a lot of treatment, we'll pay up the first $1 million. And then after that, you're on your own. Well, since the Affordable Care Act, that will not take place in America with a policy that follows the law. So I just wanted to point those two things out, because it's not so much what we're trying to see what we can do in Washington to make a better healthcare system, but certainly I want to point out there are certain things that we did not have before that the Affordable Care Act has provided, and it is a godsend. Thank you.
Great, thank you. Yes, I don't think you heard the bell, but we wanted to hear the ending anyway, so that was perfect.
I'm sorry, yeah.
Not a problem, not a problem. At a later point, I'd like to do a follow-up question with you on private insurance as well, because I think there'll be a lot of questions the public will have about that. So I'm going to make a quick note on that. Okay, the next question is going to go to Dr. Marter and Dr. Wong jointly, and you can decide who would like to go first. On the healthcare delivery side, what unique challenges has the pandemic created, and how have you responded? Now, I know you've addressed some of them in your opening remarks, some of them about technology and so on. So you may want to further elaborate on some of the things you started with initially. So who would like to go first?
I'll let Dr. Wong go first. I got first shot at the front end. So.
All right, I'll do my best. I mean, the challenges that we had to face, there are a lot, and it goes with how it started a year ago. So when we first learned about this, we just needed to understand how it spread, how to protect our patients, our staff. That was the biggest challenge. The PPE that was mentioned, that was a big challenge. And then later on, when we had the big surge, then we had issues with staff, hospital staff. We were short on hospital staff. Everyone's overworked. We're double boarding in our ICUs. That was another challenge, and we got over that. So, and right now the challenge is trying to get everyone vaccinated so that we can have protection. And the challenge is, what I've seen through all of this is being able to have coordination so that we can pivot and know what we have, what we don't have, and move things around. And I think that's the only way we can deal with the challenge as we move forward, is to be able to adapt, try to identify the next challenge, and go from there.
It sounds like dealing with constant change.
Yes.
And adapting through that. Great. Thank you, Dr. Wong. Dr. Marter, would you like to add anything?
Yeah, no, I think healthcare is always in a state of flux. It's always changing in some manner or another. And everything that I learned in medical school, not everything, but a lot of it has changed over the last several years. And COVID really did throw a curveball in terms of just having adequate PPE and having, to manage it with limited resources. And, we did the same idea with the pulse oximeters and different things like that to manage patients more at home. And I think that that's one of the challenges, was how do you manage patients outside of the hospital? Because the hospital resources were finite. We only had so many beds, and we created new ones when we didn't know we had them sometimes, but we did need to do that. And learning to, cover other people's work a little bit so that they could get a break, different things like that. We learned to make those adjustments as well. I think how we're going to respond going forward now is reassuring patients that, you know what, we have made the adjustments. We do have screening procedures. We do have masks. We want you to wear your mask. But if you do that, we can see you. We can have you come in. We can manage your diabetes. We can do some of this through telehealth, and manage it, a lot of it that way. Being able to reach out to them in ways that we can still continue to manage care. And I think that was one of the concerns that we saw early on, was that everybody was so petrified to come anywhere near anybody else, including physicians or staff, that they didn't want to come in. And so we would see people coming in, very advanced stages of DKA or diabetic ketoacidosis, when, if they come in a week earlier, we could have managed their blood sugar levels or managed a simple bladder infection that had now, kind of grown into something much more serious. And so getting some reassurance out there that, yes, we've made the adjustments, we're ready to take care of you, and we can do it now and not wait until it gets very, very serious. So that's going to be important.
Yeah, thank you. Thank you. I think reassurance is going to be a key word there, because a lot of people have spent a year at home, and to get them out of their caves and feeling comfortable being back in public and being back in any capacity, whether they're 6 feet apart wearing masks, is going to be difficult. We're used to being concerned about being around others, like you said. I'd like to move back to our Congressman. Congressman Cardenas, I have a question for you back to some policy. Considering that there are really powerful interests like insurance and drug companies that benefit financially from things like the Affordable Care Act, how would it be possible for either party in Washington to make meaningful healthcare reforms? Have we lost the Congressman?
Okay, can you hear me?
He's still on. He's on.
Yeah.
Yes.
Okay,
Yeah,
great.
on.
Did you hear the question?
Yes, I heard it completely. I'm sorry, I was on mute and I didn't realize, because my phone keeps turning off the screen, so I can't see what's on the screen. So sorry about that. When you look at, you mentioned insurance companies specifically, let me point that out. And I'm not saying anything derogatory about them, but I am saying fact. Before the Affordable Care Act, the year-over-the-year profits of the insurance companies were in double digits for most of the large insurance companies. Kaiser's separate. Kaiser's a not-for-profit. That's different. But what I'm getting at is those kinds of returns are something that many industries don't see year over year. In addition to that, we had going on at the same time that the average increase in one's premium, and those of you who provide healthcare for your workers know this firsthand, that the average year-over-year increase in premiums was anywhere between 7 to 13%, almost across the board. The Affordable Care Act, as a matter of fact, brought in a new dynamic, and then those insurance companies are still in play. They're here. Some may have bought others or bought into different systems or what have you, but they're still pretty much still on the playing field. But yet their profit margins have gone down. Again, not to the degree that they can't make profits. They've gone down some. And then also at the same time, even though the premiums are going up year over year, the premiums on average across the board are closer to 7% increase year over year instead of double digits. So I just want to point that out. So your question to me is, can we work together in a partisan way to make sure that we can actually harness the different dynamics to bring a lower cost to those who are paying for insurance, and also to the customers and to the systems that are providing that service? Yes, we can, and we are working quite a bit. Let me give you an example. You didn't hear about this because it's not cool and it doesn't get a lot of attention. On the Energy and Commerce Committee, on one day of work, culminated in one day, in many days of work, but on one day we voted out of the committee over 41 bills out of that committee. 39 of those 41 bills had a majority of the Republicans and a majority of the Democrats voting yes on 39 out of 41 bills. And the vast majority of those bills, I think it was 25 or 26 of those bills, were healthcare related bills. Some had expenditures in them, some did not. But overall, close to 9 out of 10 of the bills that we passed out of that committee in a very, very long hearing and a lot of public deliberation in front of the eyes of the whole world, we actually passed those bills. But when you hear the news, you think that we don't work together, that we can't work together. We are working together. On some things, we haven't been able to come together as well as we'd like to, but on others, we do a lot of bipartisan work in Washington. Unfortunately, it's not cool enough for the news outlets to cover that and report back to you.
Great.
Thank
Thank you so much. I wanted to say, I wish we could hear more about those things. I wish people would pick up the news reporters would pick up those stories and present them. I think we all need hope, and we all need to know that there is actually a way to work together. So thank you. Thank you for that.
Absolutely.
Let's see. I'd like to go now to Dr. Wong. If there was one thing that healthcare providers would want from Washington, what would that be?
Thank you. So the one thing we would all like is stability. And I appreciate the Congressman's help in supporting the stimulus package with help stabilize COBRA to allow COBRA subsidies so that unemployed Americans can continue to have access to health insurance is very important. Provide stability for the patients, for healthcare coverage, and for the healthcare organizations that there's not going to be an insurance crisis in the middle of this pandemic. And continuing on the theme of stability, having a stable cash flow allows us to build and invest in our organization so we can create these great ideas, especially with telehealth and remote monitoring. And I would advocate for the same thing with Medicare Advantage, which has been very successful in allowing seniors and individuals with disabilities to receive integrated healthcare. So having stability actually would be very well welcomed.
Well, if you don't mind, I'd like to chime in on it. Thank you, Dr. Wong, for recognizing what we were able to do in this rescue package plan when it comes to COBRA. That's a perfect example. As I mentioned early on, millions of families were affected by being out of work literally overnight. And COBRA became a big issue for many of those families who wanted to continue to have health care for their families and were getting it from their employer. And now that they didn't have an employer, they could not afford it. So that's something that we fought very hard to get in. Unfortunately, we weren't able to get in for almost an entire year in other packages that we were successfully able to pass. But that was a perfect example of how we weren't able to come together in a bipartisan way to get it done. But I'm glad that we were able to get it done in this last package. So thank you for recognizing that, Dr. Wong.
Well, thank you for your help. That was a nice component of the plan.
Thank you. It's life-saving, I believe.
Great, thank you. Now we're going to turn to Dr. Marter and Dr. Wong jointly, and I'd like you to elaborate a bit more on telemedicine. I know it's grown exponentially due to the pandemic and how you've had to work, and it's a great alternative right now to just reaching out to your patients. How do you think it's going to? How do you think it will survive and grow and change after the pandemic?
I'll jump in. I think that it depends a little bit on how government is willing, or CMS more importantly, is willing to continue to fund it. For Dr. Wong's side, they have more of an internal setup, but for us to deal with so many different healthcare insurances, it's important that we are able to work with them in a way that we can bill for those services, much like we would bill for any other service. So when I call my lawyer, he starts the clock as soon as as soon as the bell rings, I think, and then a few seconds afterwards, I'm sure, before he unclicks. But I think it's important for us to be able to continue to be able to bill for those services in a way that will then continue to allow them to propagate, because I think that patients need that increased access. If we can reach out to them in their own homes, a lot of times, especially with seniors, but also with many others, they have decreased mobility, decreased transportation. And so being able to just click on it and join or hit Zoom and be able to be part of the discussion with your physician really does allow for improvement in care, because it allows it to be much more accessible. allows for home visits, allows for the ability just to get into their home in some ways to increase that ability. It'll allow for hospital at home type of programs where we can be able to provide a lot of services there and be able to check on them much more frequently than you would ordinarily. And it decreases cost. And I know that everybody wants to decrease cost across the board, but if we can find a way to cut some fluff out of the system, then lowering the total cost of care is what we're all looking forward to doing to manage it better for our patients, better for everybody involved. So hopefully the premiums don't have to continue going up if we can drive our costs down.
And I have a follow-up question to that. You mentioned about billing services. Do you see reimbursement as something that needs to be looked at to help incentivize and to perhaps do more telemedicine as appropriate?
Yeah, it absolutely needs to be incentivized. I think what they've done currently is basically allow it to transition over into it's a similar payment for a set type of visit. And so it needed to have certain criteria in there, but being able to maintain that type of ability to bill for it. If there's no margin, there's no mission, is what we say a lot of times. But it's allowing us to be able to provide a service and get some reimbursement for it, such that we're able to continue that service, because everything has a cost. At our end, it does as well. But if we're able to do this type of service at a lower cost, then everybody benefits.
Great, thank you. And Dr. Wong, is there anything you'd like to add to that?
Yeah, I think telehealth is going to be a big percentage going forward because patients see the convenience. And what the patients like is what drives what we do, our goal of patient-focused care. I think the challenge is internet access is not always as easy for people as we have that we take for granted. And right now, when you mentioned reimbursement, video visits are reimbursed normally, but telephone visits are reimbursed at a lower level. And that's tough for physicians because, you know, it's not us without the internet access, it's our patients, and especially our lower income patients. Having internet access that allows for a reliable video connection doesn't happen now. That hopefully may change as technology improves and internet access gets better. But you know, those are one of the challenges. But I think patients, once they get comfortable with telehealth visit, it will be a significant driver going forward.
Great, thank you, thank you. Now
if you don't mind, I'd like to ask the two doctors to give a quick response to this question because I find it interesting. When the pandemic hit, I personally talked to some physicians, psychologists, psychiatrists about what telehealth might be like, because everybody was forced to consider it wholesale. And I had mixed reviews. A lot of the older doctors, for example, were kind of hesitant to believe that it would actually work. Since then, I've talked to many of those same individuals, and with a smile on their face, they are pleasantly pleased and surprised how effective they're able to be and how it's working so well. So any answers from the doctors about what your feedback is from your practitioners?
So for me, for telehealth, primarily my patients tend to be older. Most of them were telephone calls. And it's a function of what they have at home. So if they have something as simple as a blood pressure cuff or a pulse oximeter, I can get a lot of information. For the patients who don't have the ability to have a blood pressure cuff or use one, have a pulse oximeter, something even as simple as, you know, a scale to weigh themselves to monitor heart failure, that becomes tougher. And those patients we need to bring into the clinic. But at least there's a good percentage that we can manage at home if they're comfortable, and it's up to their comfort level. And we were doing that before, and patients were hesitant. With the pandemic, patients were more afraid of coming in, so they learned how to manage at home, and some were able to do it better, and some had more challenges. So we always adapt. If someone needed to come in to see me, they come in. If they're comfortable at home, we would keep managing it at home. And we also fortunately had the staff to help keep constant contact with the patients who were at risk.
Thank you.
Great. And Congressman, you were going to be the next question as well. And I want to pivot just for a moment to a question that's in the chat. And this is for you. Thank you for your support of community health centers and the Lift America Act, which was introduced in the Energy and Commerce Committee. Can you share how the Lift America Act will benefit CHCs and the healthcare system, and how we can help you advocate to push this forward?
Well, the Lift America Act has to do with our safety net providers, and it has to do with making sure that we are honest with ourselves, that many, many working Americans actually need to have access to their health care through these, generically we call them clinics, but federally qualified health centers. And they're dotted all over the San Fernando Valley. Some people don't realize it, and they're all over the country. And as a matter of fact, I'm very, very proud to say, being the youngest of 11 children, my father was a self-employed gardener. My mom stayed home to take care of the kids. And there was a time in our life when I was a little boy that we didn't have health insurance. So we actually got our health care through Northeast Valley Health Corporation, which started when I was about 10 years old. And I didn't realize all these dynamics until I became a congressman and realized it was the hard work of then Senator Kennedy and a lot of good people around the country who pleaded with Washington, D.C. that we need a better system to help with the people who are mostly working poor. Again, working more. My father was never without a job, but he didn't make enough money to be able to afford health insurance for 13 people. So this federally qualified health center was actually our safety net. We got to see a doctor, and I'm very proud of NEVHC. It was one of the few organizations that figured out a way to get reimbursements for dental care. Don't get me started on dental care. And as the doctors know, very, very few Americans in America actually have proper dental care, which leads to other health risks. So that's a bill that we're working together, and again, in a bipartisan way, to try to make sure that in rural America and big city America, that people can actually get the health care that they need. And again, I can't emphasize enough, most of the people who visit these organizations to get their health care are working full-time, working poor, unfortunately. Thank you.
Great. And Congressman, I'm going to go back to one of our prepared questions, so I'll keep you on the string here. And
I got about 5 minutes before I got to go. So go ahead.
Perfect.
Please,
Perfect.
go ahead.
So we'll definitely start with you then. Staying on the pandemic topic, one of the greatest successes in the past year was the speed at which the multiple vaccines have been developed and produced. What can we learn from the success of Project Warp Speed, and what can be applied to the FDA and CDC approval processes?
What we can learn is this: the United States government is the most well-prepared government in the world to do its part. However, the United States government is not the private sector. And it was in fact the private sector working with the resources that the United States government gave to the tune of billions of dollars, and also gave the flexibility for them to actually approach it in a way that they had never done before, but doing it in a safe and methodical way that actually followed the science. So that was the beauty of us being able to get these vaccines approved, invented and approved in record time, was because government did its part. The United States government provided the resources and the guardrails to make sure that it was done safely and with the kind of efficacy that it needed to be done. Now, it was the private sector that came together, literally came together. Companies that, quote, were rivals, ended up working together to bring us to where we are today. So I think it was a beautiful, beautiful example of human beings in the private sector and human beings in the public sector knowing what their role was and actually assisting each other and getting out of each other's way.
Well said. It's an inspirational story. I'm going to continue on that line of thought because of your time. I'm going to shift to the Affordable Care Act and ask you this question. The Affordable Care Act was supposed to make healthcare more affordable, yet some businesses and individuals have seen insurance premiums more than double. What can be done by Washington to help control healthcare costs? Boy, that's a 4-day question, but do your best. Well, what we can, some of the things that we can do that come off the top of my head, and we've deliberated this in committees as well, and that is this: we need to make sure that we have, again, guardrails and we have transparency when it comes to the insurance providers and when it comes to the actual healthcare providers. And also those healthcare providers, I believe, also are the pharmaceuticals as well. We need to make sure that they actually are transparent about how they are charging for their services, so that we can actually have a system. Once it's transparent, then we can actually have
CMS and other federal agencies and also state agencies actually work together to make sure that we can bring the cost down. Because, but also one thing that I'd like to add, and I think the doctors on this call would actually agree, and that is we need to be focused as much as possible on allowing individuals to be rewarded for adhering to preventative care. The cheapest healthcare to provide is the healthcare that's not needed. And it's really important that we understand in the United States of America, we have a lot of obesity. In the United States of America, we have a lot of bad habits. We're a free country. God bless us. But at the same time, it does take us to remind people and help individuals to believe and understand that they can be more disciplined and they can take more charge of their personal health. And if people take charge of their personal health, then we don't have the burdens on the overall system and costs will come down drastically. So there are things that we can do legislatively, but also at the same time, legislatively, we can actually implement things that reward Americans for actually taking care of themselves.
Yeah, and I'm going to bring that question back to Dr. Wong and Dr. Marter, because I realize you have to leave here in just a few moments, but I'd like to ask you to provide some closing remarks. I also want to say one thing from the chat box, and Nancy, if you can help me with this. There were a number of comments that came into the chat box about your question. How does the how are the people on the call seeing the American Rescue Plan? You know, the alternative plan. And there were a number of supporters and individuals on this chat that had some comments for you. Nancy, are you able to pull any up and read any?
Yeah, sure. I'm just going back to the beginning.
And then we'll go to your closing remarks right after that.
It's so great to have elected officials who understand the issues of the San Fernando Valley. San Fernando Community Health Center, a federally qualified health center in the city of San Fernando, that's a lot of San Fernandos, Audrey, is very appreciative of the support of Congressman Cardenas and his team. We are very supportive of the American Rescue Act. And then Brian Gavidia from Northeast Valley Health Corporation, they also agree with Audrey, and you are their healthcare champion. And Tarzana Treatment Center, thank you, Dr. Marter, Wong, and Congressman Cardenas. Excellent presentation. They appreciate your ongoing support of our helping those who struggle with mental health and substance use disorders. And that's pretty much it.
If you don't mind, I think you I don't know if it was purposefully or accidentally provided a trifecta of comments and people who are on the panel. My family for almost 2 decades was our provider here in the San Fernando Valley was Facey Medical Group. Thank you so much. And then also we're currently with Kaiser. And also, like I mentioned earlier, when I was a little boy, my family, my parents and myself and my 10 brothers and sisters, we got our health care from the Northeast Valley Health Corporation. So it's a little serendipitous that we're all on this call, and I'm a United States Congressman, and the people who helped keep me and my family healthy for generations are all on this call as well. So, you know, my hat's off to the Greater San Fernando Valley Chamber of Commerce. You're a pretty eclectic organization. You bring a lot of wonderful people together. Thank you.
Great, thank you, Congressman. And are there any closing remarks you'd like to make? And by the way, we're not done. We're going to go back to the physicians after this.
No, that's fine. No, look, I appreciate this opportunity for us to come together. I apologize I can't spend a whole hour and a half with you. And I apologize, I don't know what the heck was going on with my iPads and my computer. I finally got on through my phone. But again, let's do this again. Keep up the good work. And we're going to get out of this pandemic together, literally shots in the arms of human beings to save lives. And also the rescue plan, I think, is the biggest shot in the arm to our economy to get people back to work and get our businesses healthy again. So God bless everybody, and thank you for coming together. And I appreciate the opportunity, and hopefully we'll do this again soon.
Thank you,
Congressman.
Thank you, Congressman.
Bye.
Great. Well, now we're back to our trifecta. How exciting. So why don't we go back to some of our some other questions and give you an opportunity to respond to them. If we go back to the one where you're talking about preventive health and the reward for allowing preventive health, if I could throw that to both of you, how do you agree with the congressman on that, and why?
I'll jump in. So yeah, we definitely agree with them. I think the healthier people are, the easier it is to take care of them. I mean, that's relatively basic logic, I think. But I think that both of our organizations work really hard to try and maximize the preventative care, get to patients before they get sick, or to try and minimize their sickness once they start going down those paths, and try and slow the downward spiral. So I think that both of us put a lot of effort into, screenings in terms of looking for cancers, looking for conditions before they become serious. Screening for colon cancer before it ends up as a fungating mass, looking for cervical cancer, for breast cancer, all these different things before it gets away from us. It's much cheaper to manage. It's much better for the patient to manage it that way. And I think that we both spend a lot of time and energy pushing our organizations to try and reach patients before they get deep down into their disease processes. So yeah, everything that they can do to bring your weight under control, get exercise on a regular basis, eat well. I'll throw a little kudos to Kaiser. Their Thrive program was wonderful. It was exactly the right idea. And it's what we all strive to kind of mimic in a lot of ways, is that treating patients before they get sick, so that they never end up in those deep spaces, because we really want to try and make our hospitals obsolete, and just reserve them for the serious things, and try and manage everything else as early on as we can.
And Dr. Wong, how do you reward people for getting preventive care?
That's a tough question. I mean, changing behavior is challenging, but lower premiums may help. Those kind of things. When people finish their cardiac rehab, they get a diploma. Those kind of things are, encourage people to do the right thing. But I think even beyond that, I think it starts at a much earlier stage, and there should be a lot more education for kids and healthy habits, because that's where the habits start. And I see that with my kids. They watch basketball, and the number of healthy advertisements are, minimal compared to eat at this place, eat at this place, eat at this place. So these habits start young. And unless we can do something at that stage, these habits don't, become part of their lives. I have a 26-year-old male who had bypass surgery, 26-year-old, never seen that before in my career. So I think, these preventive habits going to start at a much earlier age with education, and kind of emphasizing the importance of a healthy lifestyle starting at a young age and going forward. Because even by the time they're in their 40s and 50s, that's already maybe too late for some.
Great. And continuing down that track, how are both of your organizations planning for the surge in behavioral health issues that lay ahead as a result of the pandemic? Who wants to tackle that one first?
I mean, all I can say is we have, telehealth, therapists, we have apps, everything that we can throw to be ready, that people will need to help themselves get over this. We made available. So, I'm not familiar with that part because I don't deal with mental health, but I can tell you what our organization has done for the staff. Is there every week we get reminders about wellness, about apps that we can use, anonymous phone counselors that we can call if we need help. So they're providing as much resource for the healthcare staff who've been through this, and we're going to do the same for our patients too.
Great. Dr. Marter, do you have anything to add to that?
Yeah, no, I agree. Healthcare starts at home, and we need to take care of ourselves first. And we've tried to do the same things with having concierge type of psychiatry available for our physicians, for our caregivers, for our staff, so that they are better able to deal with the patients that have these issues. Having said that, telemedicine has been a huge boon to behavioral medicine. I think for them, they skyrocketed to the front of the class in terms of number of or percentage of visits that were done through telemedicine. And that's, again, increased the access to it for our patients, so that they can have that access no matter where they are, when they need it, type of thing. we're associated, Facey Medical Group is associated through Providence, and so they have a greater telehealth program through Providence as well, so that there is more 24/7 type of access. So even if our team that's locally here isn't able to meet that need right off, there's a deeper bench beyond that. So yeah, we realize it's going to be an issue. We realize it's already been an issue, and we realize also that we've been behind the 8 ball for a long time. In California, especially, it's where I understand it better. We've never had enough behavioral medicine, quite honestly, available. And that's so much a core piece of patients' health is mental health. Because if you don't have good mental health, the rest of it just spirals very quickly after that. It's very hard to get enough exercise if you're too depressed to get off the couch. So all of these things kind of tie together. So the more we can get involved in that, the better. I think telehealth has been one of the main silver linings to this pandemic, and it's been a main boon for behavioral medicine. So the more we can leverage that, the better off we'll be.
Great. And Marter, I'm going to continue with you on the next question. So what progress is being made to address the cost of pharmaceuticals, and how can groups like Facey Medical Group minimize these costs for their patients?
So we've looked at, for medicines, we've made it a focus for our physicians across the board, because again, Facey Medical Group, there's no insurance in Facey. There's no Facey insurance, there's no Providence insurance per se. But we've managed all of everybody else's different plans. And so if you have Blue Cross, Blue Shield, Aetna, Cigna, United, whatever, we manage within their formularies. But what has happened in the last 10 years probably is a more focus on generics to try and decrease the total cost of any different medication. So our physicians are trained really to see if there's an option that's available. Not always is there an option, but if there is, we try and go towards a generic medicine. We've also hired clinical pharmacists, which can then go through the list of medications. And many of our senior patients are on multiple medications, which interact with each other and have poor outcomes necessarily. And so being able to screen through those and try and minimize that type of crossover. And then look for cheaper choices, even within different insulins or different hypoglycemics. There's huge savings that can be found by picking a little different medication within a different class to drive down those costs. And then I think we need to, continue to lobby with Mr. Cardenas in terms of lobbying with pharmaceutical companies, because there is a fair amount of fluff in that system there. But I think what we need to do while that happens is to really look at increased use of generics where possible, and then working closely with a clinical pharmacist to try and streamline the number of medications that they're on, first of all, and then really look at which classes and which medicines within those classes are less expensive, so that we can save patients a lot of money.
Great, thank you. And now I'm going to move over to a question in the chat box that's about skilled nursing. And the question reads, skilled nursing facility are the worst part of healthcare. Do the doctors have any ideas to make it better? And I'll let, who wants to jump at that one?
I can't touch on that because I don't work in a skilled nursing facility. That's a tough one.
All right, I'll jump in a little bit then. So that's always been part of the circle that we have in terms of taking care of patients in the ambulatory setting. If they graduate from us, then they end up into the hospital frequently. And then, are they able to go home, or are they too sick to be able to go home, but they're not sick enough to stay in the hospital? And so that's where our skilled nursing facilities come into play. Again, Facey, Providence does not own, maybe Providence does, but not in this area, any skilled nursing facilities. But we have now transitioned 2 of our hospitals into becoming what we call SNFists, where they do go to the different skilled nursing facilities and round on the patients on a regular basis. We've now incorporated those doctors into our team of physicians that take care of those patients. And so we have actual hospitalists in the different SNF facilities to try and work with that. And so this has just happened in the last year or 2. So I'm going to try and absolve myself of any guilt of the previous activities of the SNFs. But going forward, we're really working with them to try and improve the care and to work on their quality measures So many of the ones that they work at, those two physicians are becoming the medical directors for those places to work on different quality measures to try and improve outcomes, because we recognize that, yeah, it's been an issue that we've had a lot of problems with them over the years. In the San Fernando Valley, they tend to be overrun, so they're very, very full. And that's been our difficulty, as well as how do we interact with somebody that doesn't need our business because they're already flush. But I think as we've developed those relationships and gotten embedded with them, we're able to be able to influence the care that they receive there. And so that's what we're working on going forward.
Great, thank you. And I'm going to throw you a question that's not something that was pre-prepared, but it's sort of stimulated by what our congressman was talking about. Let's say that there's active work towards Medicare for all plans. Who should be involved in this conversation? And I'd like to ask both of you that question. Dr. Wong, why don't we start with you?
I think the devil is in the details. I mean, I'm not sure what Medicare for all means without getting into it. Because let's be honest, Medicare only covers 80%. There's a 20% that needs coverage. Medicare doesn't cover drugs. There's a separate drug plan, Medicare Part D. So when we talk about Medicare for all, we really need to get down into the details how it's gonna work. Is how are we going to treat the insurance companies? It doesn't make sense to get rid of that, and because the infrastructure is there, we need to just fine tune it, make it work for us, or make it work for us as a group, and for the patients. So without knowing more details, Medicare for all really is, I don't know what it means.
Right. Okay, Dr. Marter?
I think, again, we're all kind of philosophizing on what it actually means, but I think Medicare for all is that there is some insurance for everybody. And I think that is something that we can get behind, because I think when patients come in to ERs or to other places where they need care, there's a cost, and there's a cost that's associated with it. And historically, the hospitals have absorbed that cost in one way or another through, unsupported mandates of EMTALA or different things like that, where they have to take care of the patient. But it's an expensive place to do it. And so if you can find ways, like Dr. Wong said, to coordinate the care, provide those different levels of service at the appropriate levels, is where I think you're going to finally get traction on all of this. I think a lot of the bad press that America has gotten over the years for, having, poor outcomes and really expensive care is that we have very expensive care, and a lot of people can access it, but we also have a significant population that can't access the care because they don't have the insurance, and healthcare is expensive. And so having something that they can, be able to access is going to be important, and then being able to support that in some way. We've, over the years, built various other places, FQHCs, Northeast Valley Health Corp, Kaiser, Facey, are different places that have learned to coordinate care so patients can receive their care at hopefully a lower cost of care overall, to be able to manage these issues. And so hopefully that's what it means. And the government would have some backing behind that to be able to support that. Where it's going to be a blanket, this is the new and different, and everything else goes away, isn't going to work very well, because it is going to become exorbitantly expensive, and you need infrastructure in order to roll that out. So I think there's going to be a lot of barriers to it otherwise.
Yeah, I think, the ACA, for, different opinions, it has significantly reduced the uninsured rate in California. I think 60% is the number I heard most recently. So we have a program that does work to help provide universal coverage. How we roll it out further, that's the next step.
All right, thank you. Well, we're now coming close to the end of our session. I want to throw it back to Nancy to see if there were additional questions in the chat box that we'd like to ask you. And if not, we could have closing I want to say arguments. That's not right. Closing comments. We're not arguing. So Nancy.
No other questions in the queue.
There was, I'm sorry, I didn't hear you.
No other questions.
No other questions. Okay, so why don't we go ahead and wrap up with Dr. Marter. Would you like to just provide comments, whatever you'd like to say to wrap up this session today?
All right, well, thank you very much for the opportunity to get in front of a a group of people that really do influence so many people throughout the San Fernando Valley. I think where, you know, small businesses and larger businesses can work together with health insurances or health companies that, like, you know, Kaiser or Facey, that provide that coordination of care is going to be really important. And understanding that coordination of care is really where the total cost of care can be driven down, where we can try and do population health. That's the new catchphrase out there. But population health is managing patients before they get sick, trying to reach out to them ahead of time, manage these patients. And you can't do that without a network of support around you. Facey has, you know, a broad network of primary care physicians, pediatricians, specialists, and we all interact and talk amongst ourselves so that we can coordinate patients' care. And this is a coordination that happens at many different organizations. It's not unique to us. We work harder. I think we work hard to make it better than everybody else, but that's everybody's goal, I think. But I do think that we become adept at being able to coordinate the care so there's not overlap and there's not excess cost that goes into managing patients, and being able to reach out to them again early on in the process. But if they do end up getting sick, we have the expertise to manage those sick patients as well. And if they get really sick, we can manage that as well. And again, to be able to manage that total spectrum of care, from ambulatory to preventative to ambulatory care to hospitals to SNFs, and then back around again, hopefully back home, is all part of what we can do to try and coordinate that care so the patient gets a full spectrum of care, not having to doctor shop and get various opinions here and there, but not have that be coordinated and networked together appropriately. So again, I appreciate the opportunity to get in front of an astute audience like this that really does have to manage healthcare on a global basis for your employees. And we really relish the opportunity to be able to work with you in that regard. So thank you very much for the opportunity.
Great, thank you, Dr. Wong.
Yeah, thank you very much for the opportunity to present in front of this audience. You know, I was in private practice for many years and understand the challenges of purchasing insurance for our staff at that time. And also want to echo Dr. Marter's point is, you know, we're all in this together. We're all trying to help each other out. All of us will end up accessing the healthcare system at one point in our lives, and having that coordination, working together, and with a common goal of improving healthcare for everyone. That's all we want to do. And Kaiser Permanente is proud to be part of the community and to help serve in any way we can.
Great, thank you. And before I turn it back over to Nancy, I just wanted to note there's some beautiful comments in the chat. I don't know if you got a chance to see the chat or not, but one says, thank you so much to you and the frontline workers here in LA, throughout California, around the country and around the world. And that's from Robbie Gluckson at UCLA Health. Somebody put in where to get a shot tomorrow. How's that for collaboration? There's another wonderful comment. This has been a very interesting presentation from 3 different viewpoints. Thank you for putting this together. So with that, let me hand it back to Nancy and we can conclude our program.
Well, I'm actually handing it over to Josh.
Thank you, Nancy, and thank you, Cindy. Really, guys, just on behalf of the Greater San Fernando Valley Chamber, I want to thank our guests here, Congressman Tony Cardenas, Dr. Roscoe Marter, and Dr. Richard Wong, and obviously as well as Lisa. Thank you guys for facilitating. Cindy, sorry, Cindy. Thank you for facilitating such just an insightful dialogue here. I also want to express the Chamber's appreciation and our sponsors, California Lutheran University, SoCal Gas, for making today's Policy on Tap possible. Now, we do have the next Policy on Tap event, and that will be taking place on May 11th. And the discussion there will be in regards to retail and restaurants to discuss how they will recover as we begin the path to returning to normal, hopefully here fairly soon. Registration for the May Policy on Tap is available in the chat or on our Chamber's website. So thank you all for participating and have a great rest of your evening. Thank you, everyone.
Thank you.
Thank you, everyone.